You are live, sir. You can show.
Yeah, hi viewers. I'm Dr. Phani Krishna Ravula. I'm a surgical gastroenterologist and a liver pancreas specialist. Today, this live session is to discuss about pancreatic diseases. The pancreas is an organ. Is an important organ that is located in the back. It's just located in front of the spine, so to the back of the body. Mm. That's why many of the routine investigations, ultrasound, endoscopy, they don't pick up the pancreas because there are a lot of intestines in front of it, and pancreatic pain comes to the back. So that's the location of the pancreas. It's a fatty kind of structure, long tubular structure. It has mainly two functions. Uh, you know, it can basically one is the of course the insulin production. It not just produces insulin but also other stuff like glucagon and all that, which regulate the glucose homeostasis in the body, the glucose absorption and utilization. So it and a deficiency of insulin obviously causes diabetes, type 1 diabetes, and deficiency of insulin resistance, secondary to obesity and all that, causes type 2 diabetes. Pancreas is also an important digestive structure, and it is good to important, especially important for fat digestion. Like in the body, the the what in our diet we have carbohydrates, fats, and proteins, right? So the carbohydrates can be digested by the saliva, the gastric juice, duodenal juice, intestinal juice, like that. The proteins, you have protease in the gastric juice, duodenal juice, intestinal juice. But the fat absorption, the lipases, they're predominantly and exclusively produced in the pancreas. So pancreas is very important for it helps in protein digestion also, but the fat digestion function is exclusive to the pancreas. So if pancreas stops producing working well, your protein digestion and all is okay because the other intestinal parts they take over, but the fat digestion would be the fat digestion would be not so good because the lipase is exclusively secreted by the pancreas. So pancreatic diseases. So that's why when you have pancreatic diseases, one of the features of that is basically steatoria. That means when you have pancreatic insufficiency related to whatever disease, malignancy, chronic pancreatitis, fat digestion is absorbed is like restricted. So you get something called steatoria. Steatoria when the stools become oily, greasy, a lot of bloating, gas formation, and all that. And because of that, secondly, you develop multiple deficiencies: vitamin A, vitamin D, vitamin E, vitamin K. And because the fat malabsorption, the eye health, skin health, heart health, kidney health, bone health, and all get affected. There's several diseases of the pancreas. Hmm. Well, you have mainly two. Basically, you have pancreatitis, and you have something called acute pancreatitis and chronic pancreatitis. There's two types of pancreatitis. In acute pancreatitis, essentially, it's an acute inflammation of the pancreas. The pancreas swells up, and it can present like acute. It presents as an emergency, sudden onset, severe abdominal pain, like that. So in the olden era, it used to be missed quite a lot because patients come with acute pancreatitis. You do ultrasound and X-ray, it doesn't get picked up. But now CT is there all over the place, so acute pancreatitis gets picked up quite early. Once you do a CT, any patient who has pain abdomen and your X-ray doesn't show gas and diaphragm, then you have to suspect acute pancreatitis, and CT is a very good investigation to rule out that. Acute pancreatitis is caused by gallstones, alcohol. These two are the more common causes. Then there are several other etiologies, rarer etiologies, viral infections, COVID, dengue. They can cause pancreatitis. Some drugs, steroids, some psychiatric drugs can cause pancreatitis. Um, Genetic mutations, like there's several CFTR, SPINK1, PRSS1, and all, they can cause recurrent acute pancreatitis. Pancreatic structural anomalies such as pancreas divisum, and they can cause pancreatitis. So all these are the various etiologies of pancreatitis, and the so acute pancreatitis, once it comes, it can be there are three types. It can be mild, moderate, or severe. Mild acute pancreatitis would be, the mild inflammation of the pancreas with no necrosis, no organ dysfunction. Moderate pancreatitis, usually, again, it's slightly moderate, so that some degree of pancreas gets necrosed partly, and they have one or two organ dysfunctions, and they have pancreatic collections and all that. Severe pancreatitis is when a really extensive necrosis of pancreas occurs, and in the acute phase, it can present with severe BP gets low, the breathing difficulties, need for dialysis, and all that. And in the long run, the necrotic pancreas can get infected, infected WOP and infected necrosis, which can lead to other problems like severe infection, further organ dysfunction, and lead to death also. So, pancreatitis is a pretty serious condition, and especially severe pancreatitis is associated with the 20-30% mortality. And acute pancreatitis is not something that can be managed everywhere. There's a lot of scientific data and a lot of new concepts that are behind acute pancreatitis. So, once a patient gets acute pancreatitis, it's always better to manage as a center of excellence. Unnecessary treatments, unnecessary antibiotics, unnecessary early interventions, all these things, and actually, they are not just expensive; they worsen the patient also. So, it's very important to make the decisions in pancreatitis. So, once upon a time, a lot of patients used to die, but now with necrotizing pancreatitis, we are actually able to salvage most of the patients by doing minimally invasive approach, because in the olden days when the pancreas gets necrosed, they used to open the whole abdomen and all that, and they would the insult, when the patient is so physiologically weak, the major surgery would lead to decompensation. But nowadays we are doing the same thing in minimally invasive way, and most of the patients, they actually tolerate the procedure quite well. The other form of chronic pancreatitis is chronic pancreatitis, and chronic pancreatitis, basically, the pancreas gets scarred, and you'd end up with diabetes, and you end up with exocrine dysfunction. So, chronic pancreatitis is a different form. Acute pancreatitis comes as one severe attack. Some people can have recurrent acute pancreatitis. Chronic pancreatitis is like over years, recurrent attacks of pain occur, and slowly the pancreas becomes scarred, and the pancreatic ducts becomes abnormal. They become dilated. They develop stones and all that. These patients develop diabetes at a young age. They develop severe malnutrition, weight loss. They can develop, exocrine insufficiency, steatorrhea. They can develop jaundice, and they can develop cancer as well. But the main symptom they present with is severe abdominal pain. The etiology of chronic pancreatitis, again, alcohol is one of the common causes. In India, we have something called idiopathic tropical chronic pancreatitis. This is an exclusively South Asian disease, mainly in Kerala, Tamil Nadu, Andhra, that side. So now also in East India, also it's there. This chronic pancreatitis can be, you know, so one is the idiopathic chronic pancreatitis, then the alcoholic pancreatitis, then there are other etiologies of chronic pancreatitis as well, like autoimmune pancreatitis is there, hereditary chronic pancreatitis related to genetic mutations, and structural chronic pancreatitis related to tumors, and like that also can occur. Chronic pancreatitis. So pancreatitis is best diagnosed by CT scan. In chronic pancreatitis, you may also need an MRCP. Simple blood tests like amylase, lipase. There are two blood tests. If a patient comes with acute abdominal pain, we can do them and diagnose pancreatitis. Acute pancreatitis, most of the time CT suffices. The CT may have to be repeated in the second week or so to look at the pancreatic complications. Chronic pancreatitis, on the other hand, it's like the chronic pancreatitis it's the diagnosis is usually by a CT scan. We basically look at the pancreas scarring and the stones, the ductal dilatation, any local complications such as pseudoaneurysms, bleeds, and all that. And the management again depends on that. In acute pancreatitis, of course, is complex multi-specialty management. Early phase, the intensivists have to manage the hypertension, kidney failure, and all that. Then in the late phase, when the pancreatic local complications occur, the endoscopists or surgeons have to do their job, draining out the infected collections. In chronic pancreatitis, likewise, if the patients are persistently symptomatic, in the early phase, we give medication, pancreatic enzyme supplements, and antioxidants and pregabalin and all that. The kind of medical management. In patients who don't respond, in some patients, we can attempt ERCP and stenting, and breakage of pancreatic stones by spicoscopy. So that has about a 50 to 60% chance of success. In patients who don't respond to medical management or endotherapy, surgery is a good option. Surgery in selected patients. Not every patient is eligible for surgery, but patients with large duct disease, we can consider them for surgery. And the surgery would be basically what we do is we do something called a phrase LPJ. That is basically we lay open the pancreatic duct and core out the head and make sure that the ductal drainage occurs. Then, yeah. So that's with chronic pancreatitis. Then other so pancreatic malignancies. Pancreatic malignancies, of course, there are several types. I mean, the commonest what we see is pancreatic adenocarcinoma. We'll talk about pancreatic adenoma. Other rare forms are you have cystic neoplasms of pancreas like mucinous cystinomas, serous cystinomas, which are relatively better prognosis, and then you have neuroendocrine tumors of pancreas again, which are slow growing and slightly better prognosis depending on some types and all that. If type 1 neuroendocrine, type 1, type 2 is very good, while type 3 neuroendocrine tumors behave aggressively. Pancreatic adenocarcinoma, well, pancreatic adenocarcinomas can, the presentation is usually with unexplained weight loss and abdominal pain. So, any elderly patients, they have unexplained weight loss and abdominal pain. Normally, they'd go to a local physician, they'll get an ultrasound done, they'll get an endoscopy done. Ultrasound will be normal, endoscopy will be normal. Sometimes ultrasound will pick up something like gallstones, and they'll get unnecessary treatment for gallstones. So, if a patient has progressive, especially pain radiating to the back and associated with weight loss in the upper abdomen, we should always suspect malignancy. That too of a new onset. That is, patient has symptoms for 2 years, 3 years, is unlikely to be cancer. But if patient has all these symptoms of recent onset, like 2 3 months, it is more likely that it's a malignancy. Then, so yeah, let's hide. So, okay, there are some questions, I guess. We can answer those. Hello, doctor. Can pancreatic diseases cause diabetes? Of course, pancreatic diseases can cause diabetes. You have chronic pancreatitis, and it can actually cause diabetes because the islet cells can be destroyed in the disease. And the what causes pancreatitis? Like I said, there are several causes of pancreatitis. Acute pancreatitis, most common causes are gallstones and alcohol. Um, while chronic pancreatitis, the two main causes are alcohol and something called idiopathic chronic pancreatitis. Other than that, you have basically you can have metabolic causes like hypercalcemia, hyperparathyroidism, hyperlipidemia. You can have autoimmune pancreatitis. You can have genetic causes like mutations and all that. But yeah, I think the commonest are gallstones, alcohol, and idiopathic. But there are several other structural abnormalities can be there. So once these two causes, once they're ruled out, you should go to a gastroenterologist who can really work you up and tell you what's going on. Can pancreatitis be cured permanently? Not all forms of pancreatitis can be cured permanently. I mean, some pancreatitis, acute pancreatitis, which is due to, let's say, alcohol or gallstones, or hyperlipidemia or hypercalcemia, those kind of pancreatitis, by treating the underlying cause, you can completely cure pancreatitis. And some cause of chronic pancreatitis, like chronic pancreatitis related to the alcohol and idiopathic chronic pancreatitis, by surgery you can cure the pain permanently. You may not be able to reverse the pancreatitis because the basic at the cellular level you can't really reverse the disease, but all the symptoms of the pancreatitis you can reverse. If a person is having pancreatitis, what kind of food should they avoid? Well, basically, uh, you know the fatty foods are not digested. So traditionally, I mean, the broiler chicken, the red meats, and deep fried oily foods, fatty foods, and all that, which have a lot of oils and fat. Those kind of foods should be restricted, not completely avoided, Because once you meet a doctor, most of the time what we do is, see, one of the problems is patients, they're asked for severe fatty food restriction, but it is not needed, because once you have pancreatitis, you go to a gastroenterologist and he's going to basically put you on some pancreatic enzyme supplements like creon, agna, I mean basically pancreatic enzymes which contain lipase. So the reason why we restrict fatty foods is basically the in patients with pancreatitis, the fatty food digestion is impaired. But if on the other hand, the pancreatic enzyme supplements are given, we can take those foods actually, but in moderate levels of fat restriction, fatty food restriction, not severe restriction. Like I said, a lot of pancreatic diseases can cause diabetes, can cause Anila Azaz. So pancreatic diseases can cause diabetes. I mean, chronic pancreatitis, severe acute pancreatitis, any tumor. So one more thing is any new onset diabetes. A person who's been all right all these days, and any new onset diabetes, and when you go to a physician, also it's nice to get your pancreas evaluated, especially if the new onset diabetes is associated with any weight loss, any abdominal pain, any jaundice, and these kind of future features. It could be directly related to pancreatic disease, of course, but predominant cause of pancreatic diabetes in our country is type 2 diabetes. That is not related to the pancreas directly. Can I drink alcohol if I have a pancreatic condition? Uh, yeah, no, you can't. I mean, like, it's generally alcohol is damaging to the pancreas. So if you have had history of especially pancreatitis, acute or chronic pancreatitis, alcohol is strictly prohibited. What tests are done to check the pancreatic function? Basically, see, the pancreatic pain, we can do amylase, lipase, simple blood tests. The pancreatic exocrine function, the fat digestion, we can do tests like fecal elastase, which is the pancreatic enzyme levels we measure in the stools, and stool droplet and stool fecal steatocrit, which measure the amount of fat in your stools. If it's high, that means your pancreatic function is poor. And for the pancreatic endocrine function, you can do basic simple tests like you can do the fasting C-peptide, fasting insulin test, postprandial C-peptide, postprandial insulin test. We can find out how much of C-peptide and insulin pancreas is secreting. Then we can check your sugars, HbA1c. They'll also reflect. If you have poor pancreatic function and diabetes, your HbA1c, fasting blood sugars, they'll also reflect. Can I live without my pancreas? Yes, a lot of patients do live without a completely non-functioning pancreas. So basically, if the pancreas becomes recurrent attacks of severe acute pancreatitis or chronic pancreatitis, they can still live obviously without the pancreas with medication. For the diabetes, you'll be on insulin. For the severe steatoria, you'll be on high-dose pancreatic enzyme supplements. So, but the diabetes is a bit difficult to manage in these patients. It's brittle diabetes, very fluctuations will be there and all that. But yes, we routine in for some cancers we take out the entire pancreas to do a total pancreatectomy, and sometimes chronic pancreatitis, acute pancreatitis, the attack is so bad that the pancreas gets necrosed. So even in those patients, the patients can survive. Yes, with modern medicine, the all the pancreatic supplements can pancreatic insufficiencies can be managed medically. Can pancreatic problems return even after treatment? Yes, pancreatic problems can come back after treatment. That's like common in chronic pancreatitis. Success rates around 80%. So only the 20% of the patients, the pain can come back. And like I said, even the chronic pancreatitis in the treatment of pancreatitis, we are mm, reversing at a pain level. They're creating the ductal blocks, but at the cellular level, we're not reversing the disease. So even for that, you can have basically once you do the surgery, your diabetes and your exocrine insufficiency, all those things can persist. Endoscopic ultrasound. So endoscopic ultrasound is a specialized test. Like I said, endoscopy, pancreas lies outside the digestive tract. Let's say you have stomach cancer or a duodenal ulcer, you can see directly by an endoscope. And but on the other hand, the pancreas lies behind all the intestines. A regular ultrasound does not see the pancreas. With a CT scan or something, you can see the pancreas, but if you need a biopsy or something like that, or some treatment of the pancreas, it can't be done. So endoscopic ultrasound is something which has been around for the past 15 years or so. Basically, at the end, you put in an endoscope through your mouth. At the tip of the endoscope, you have a ultrasound machine. The ultrasound goes next to the pancreas, and so if this is the duodenum, it goes in there, And if the pancreas is here, it goes next to the pancreas through the intestine. You can do a detailed study of the pancreas. More importantly, you can't just do a study of the pancreas. You can also do a biopsy of it. You can sometimes, like pancreatic cysts or pancreatic pseudocysts, you can drain them, you can fulgurate them, ablate them. A lot of treatments you do. So essentially, endoscopic ultrasound is a specialized ultrasound which is attached to the tip of the endoscope, which gives you excellent access to the pancreas, including pancreatic biopsies and pancreatic procedures. Can blood tests detect pancreatic cancer? Blood tests, some blood tests give a clue towards pancreatic cancer. I mean, CA99 is a blood test that can be elevated in pancreatic cancer, but they are very non-specific. I mean, you can't diagnose pancreatic cancer solely based on blood tests. I mean, it can something like acute pancreatitis or acute pancreatitis also you can have elevated pancreas. So chronic pancreatitis you can elevate it CA99. So sometimes, but if they're very high levels, like more than 1,000 and all that, then you can be very sure that it's an advanced pancreatic cancer. To answer your question, some blood tests are positive, but you can't rely on blood tests to diagnose pancreatic cancer. Yeah, minimally invasive surgery. Are there minimally invasive surgical options for pancreas? So minimally invasive surgery is gone big thing in pancreatitis. Like I said, the necrotizing pancreatitis, once upon a time, when you do massive open surgeries, cut open the abdomen, do the necrosectomy, there used to be a mortality of 30%. We have not lost in my unit for the past 10 years, not a single necrotizing pancreatitis patient, because we do minimally invasive surgery, retroperitoneoscopy, video assisted retroperitoneal debridement. So the incision through the flank, we enter directly into the pancreas without entering the rest of the abdomen, and do it off. So that way, the physiological insult to the patient is very less, and they tend to do very well. Likewise, the pancreas being a retroperitoneal organ, large incisions were needed. No, almost all pancreatic procedures, Whipple's and distal pancreatectomy, central pancreatectomy, spleen preserving distal pancreatectomy, almost all of it, as a rule, we do it by laparoscopy. But sometimes pancreatic cancer and all that, not all patients, because a very major surgery like Whipple's or pancreatic cancer is a very major surgery. So we look at factors like how fit is the patient, how is he tolerating how can he tolerate a prolonged general anesthesia. So majority of the surgeries, almost all pancreatic surgeries can be done minimally invasive. We mostly do the minimally invasive, 90%, about 10% of them, depending on the patient's condition or the extent of the surgery, we might do them open. So digestion affected by pancreatic disease. So pancreas is important for fat digestion, like I said. So patients who have pancreatic diseases severe, their fat digestion is improper. They'll have steatorrhea, they'll have weight loss, they'll have something called cytophobia, because once you eat food, immediately the pain starts. So they're actually scared of food. So all these problems and digestion get affected in chronic pancreatitis patients. They can have severe diarrhea related to fat malabsorption, vitamin B12, vitamin A, D, E, K deficiencies, and all that. Yoga, meditation, other holistic practices. Yeah, I mean, it's like they help in everything like that. I mean, there's no specific scientific basis for it, but definitely, see, especially something like chronic pancreatitis, acute pancreatitis, the patient's mental strength and the psychological profile is very important. Patients are prone to depression, anxiety, painkiller addictions, and all that. So definitely, yoga and meditation and other holistic practices would may not cure the pancreas, but they would help the patients to handle their disease better. So yeah, thank you for getting on clearly and patiently. Thanks, Anila. So, like you're saying, in pancreatic cancer, the any elderly patients unexplained weight loss and all that, you can if the unexplained weight loss of recent onset and this thing, they are usually diagnosed late. So whenever patients have, for all the doctors and the patients, if there's an elderly patient who gets pain abdomen and unexplained weight loss, don't rely on just endoscopy and ultrasound. We should be liberally get a CT scan done. Pancreatic cancer, of course, it's like once it's diagnosed, we stage it by CT scan, MRI, and all that, and a PET CT scan, CA99. These are all endoscopic ultrasound. These are all the various tools. Not everything is used in all the patients, but we use the tools, and we diagnose the pancreatic disease, and once the disease staging is done, we decide to treat it based on that. Patients with resectable tumor, they get upfront surgery, and patients with locally advanced tumor, we might give them some chemotherapy or radiotherapy. Downstage disease, that is, shrink the tumor before the surgery and then do the surgery. Of course, a lot of patients do present with a very advanced disease, and nothing can be done. So in those cases, patients, we go for palliative treatment, and palliative treatment for the palliation, for the pain, for the vomiting, for the jaundice and all that, and also palliative chemotherapy. Thank you for all the questions. We had a great show, man. Are we okay?
Yes, sir. We can.
Okay, thank you.
Thank you. Thank you very much, sir.
Thank you.